Employers ask us all the time, is occupational health and safety really, does it make sense for that to fall into the mental health realm or psychological health and safety? That doesn't make sense. It's a term that's kind of hard to understand. But for us, it's really about the scenarios we encounter. We'll often be working with an organization's employee who's been away from work for, I don't know, maybe 3 months already. And the issues might be mental health related. And it could be that they derive largely from situations that were in the workplace. They may have a really stressful work environment and they've been responding to that stress. One example is, it comes to mind, is the forestry industry. They are under unbelievable pressure to produce. If they're not producing, they're not making money. And that means they're losing money. And that pressure that the industry feels gets passed down from, the boardroom down to the frontline worker. And in a culture where physical safety is paramount, they will penalize and discipline employees who aren't following physical safety rules, because it's so important having, that sign outside the building. How many days have we had without an occupational injury? They count those days and they're important. But then the pressure and the stress that gets exerted onto that frontline worker to produce, well, that can also have an impact. And that's what psychological safety is all about, is understanding the big picture and the environment that is around your workers. Probably the best way that you can get a sample and get a taste or a flavor of what the psychological safety environment is in your workplace is ask your people. Ask them how it feels. Ask them if the stress of their job is impacting on their ability to do it. And sometimes the answer won't be very comfortable. But for us, the ability to know where to look and the questions to ask for an organization is paramount to prevention. If you know the questions to ask and how to ask them, use the tools that are already in place. Your Joint Occupational Health and Safety Committee, is psychological safety on their agenda? Are they doing routine, studies or, reviewing work environments or workplace injuries? Are they asking questions about other factors that might be impacting on them? There's a lot to learn about psychological safety in the workplace.